Hi everybody, my name is Dr. Hilary Booth and I'm a naturopathic doctor, and welcome to my video blog. Today we're going to be talking about prostate cancer prevention. So prostate cancer is the most common cancer to affect Canadian men. 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Movember is a fantastic month where men come together and are supportive about cancer research and about raising money and about prostate cancer awareness. However, a lot of focus isn't given to how to prevent prostate cancer. So I thought it would be important today to talk about how we can prevent prostate cancer regardless of your risk status, regardless of your age, things that you can be doing in your daily life to reduce your risk of developing prostate cancer. So first of all, it's important to know your risk. Your risk of prostate cancer is increased if you have any of the following. If you're over the age of 50, if you have a father or a brother who has been diagnosed with prostate cancer, if you are of African or Caribbean descent, if you are overweight, and if you have a low fiber or high fat diet, and if you smoke. Regardless of your risk status, though, there are things that you should be doing in your daily life to reduce your risk of prostate cancer now. So I'm going to be talking about my top 6 tips today that you can start doing. Tip number 1 is to get tested. If you are over the age of 50, or if you have a father or a brother who has been diagnosed with prostate cancer, you need to be testing at the age of 40 and over, and there are certain things you need to get tested. The first thing is something called PSA. This is your prostate-specific antigen, and it's a simple blood test. And what this does is it gives your doctor an idea of how you're progressing over time, whether or not that number is increasing at a specific rate, can help to tell whether or not we're developing prostate cancer. Also, if your PSA is above a certain level, then your doctor is going to be doing further investigations to see whether or not prostate cancer is a diagnosis that you need to explore. The second thing you need to get tested is having a DRE done. This is a digital rectal examination. This needs to be done annually after the age of 50. Now, a lot of men are uncomfortable with the idea of having a DRE done. However, it's extremely important for early detection and early prevention of the progression of both colorectal cancer and of prostate cancer. So please, please, please consider getting this test done. It's extremely important for your overall health. My number 2 tip is to incorporate something called lycopene into your daily life. Now, lycopene is actually found in tomato sauce, in tomatoes, and in tomato paste. Interestingly, the amount of lycopene is increased in tomato paste as compared to tomatoes. And it's been shown in studies to significantly reduce the amount of PSA that we see in your blood, and also to modulate the hormones in your body to reduce the risk of prostate cancer. So now a dose of 10 to 25 milligrams per day, if you're going to take lycopene as a supplement, is what you need to be having, or having 50 grams per day of tomato paste to get that adequate medicinal dose where you're having that prostate cancer prevention. My number 3 tip for you is to increase the consumption of flax seeds and soy products. Now, flax and soy are what we call estrogen modulating foods. When we can modulate estrogen in your diet, it's actually going to reduce the amount of testosterone binding to the prostate cells, which reduces the amount or speed of the prostate cell growth, and this reduces your risk of developing prostate cancer. So what you want to be having is 2 tablespoons per day of freshly ground flaxseed, meaning you're going to buy it whole and you're going to grind it yourself 3 to 5 days worth at a time is all you need. You're going to keep it in a sealed container in the fridge. And what this does is it prevents those flax seeds from going rancid when they're freshly ground, and also making sure that you're getting adequate amounts of sort of the medicinal properties of the flaxseed, which is released when you grind those seeds. Now, you're also going to be incorporating soy by having tofu and miso and products like that in your weekly eating routine. My number 4 tip is that you should be taking fish oil and borage oil. They've both been shown to inhibit the formation of the malignant, meaning the cancerous cells in the prostate, by increasing the release of things called prostaglandins. And those prostaglandins help to inhibit the testosterone binding to the prostate, and that inhibits the prostate growth toward cancerous cells. So you should be looking to have 1 gram per day of GLA. GLA is the active ingredient found in borage oil or evening primrose oil. And you need to be looking to have 1 gram per day of EPA. And EPA is the active ingredient found in fish oils. So look on the back of those supplement containers and look for those active ingredients rather than just the total amount of fish oil, for example. You actually want the total amount of the active ingredient of EPA in fish oil and of GLA in borage oil. In order to have that medicinal effect. If you have any bleeding or clotting disorders or on any medications, please speak with your ND before taking these supplements, as well as if you have any upcoming surgeries, you need to speak with your ND because they can interact with anesthetics and with other medications that you're on. My number 5th tip is to make sure that you're actually not having too much zinc. Too much of a good thing isn't always good. So the amount in your multivitamin is fine, but the issue becomes when people are taking workout supplements and protein powders with fortified things and taking a multivitamin or zinc supplements all at the same time, your daily dose should not exceed 30 milligrams per day. So add up all the amounts that are in all your different products and make sure you're not exceeding 30 milligrams per day because basically this can encourage the growth of prostate tissue, which can encourage the growth of prostate cancer. My 6th and final simple tip that you can do is to reduce your other risk factors. So that means quitting smoking, that means maintaining a healthy body weight, that means reducing your alcohol intake to no more than 2 drinks in a sitting and no more than 14 drinks in an entire week. You're reducing your stress levels. That might mean deep breathing and relaxation. That might mean downtime or de-stressing time in your day. You need to make sure you're having healthy cholesterol levels by eating a healthy diet and exercising regularly, and making sure that you're avoiding secondhand smoke. The secondhand smoke and smoking contains cadmium, and cadmium is a heavy metal that causes prostate cancer. So to recap all the things that we can be doing, number 1 is get tested, do your PSA testing and your DRE testing after the age of 50 or after the age of 40 if you have a first-degree relative with prostate cancer. Number 2 is including lycopene, that's tomato paste, or having lycopene as a supplement. Number 3 is increasing your flaxseed and your soy consumption. Number 4 is taking a fish oil and borage oil to get those adequate doses of your active ingredients there. Number 5 is making sure you're not having more than 30 milligrams of zinc per day. And number 6 is to reduce those other risk factors like alcohol, smoking, cholesterol levels, and your stress levels to make sure that you're maintaining a healthy overall lifestyle. That's it for prostate cancer prevention today. If you have any questions, please feel free to contact me. Don't forget that it's the end of the year. We should be using up the rest of your benefits now, so don't forget to make your appointment with me. You can do that by going to daruwellness.com or by phoning the clinic, and we'd be happy to help. Thank you so much for watching, everybody. I hope you have a wonderful week, and I hope that you learned something today about prostate cancer prevention.